thank you for joining me to discuss operating in a state of control, as defined by the United States FDA. Before we get into the subject, let me tell you who we are. FDA Compliance Help is a small group of regulatory specialists that install quality systems, prepare and shepherd 510(k) submissions to approval, and do ISO FDA compliance audits. Our business model allows us to keep overhead low and provide high quality at an affordable price. Plus, our clients are covered by a 100% satisfaction guarantee. Now that you know who we are, let's get to the subject of this video, operating in a state of control. What does that mean? Operating in a state of control means all system activities are being properly and adequately performed. Further, it means perpetually updating the quality management system to address today's requirements. Is your medical device firm required by the FDA to operate in a state of control? If your firm does any of the following, then the United States FDA says yes. This is because the FDA defines a medical device manufacturer as any firm that designs, manufactures, fabricates, assembles, or processes a device. Manufacturer includes but is not limited to those who perform the functions of contract sterilization, installation, relabeling, remanufacturing, repacking, or specification development, and initial distributors of foreign entities performing these functions. To operate in a state of control requires top management to frequently demonstrate a commitment to the quality system in word and deed. All employees to take ownership of their part of the quality system and accept responsibility for his or her role in it. All stakeholders to embrace rational problem-solving practices versus quick-fix solutions and firefighting. All managers and employees to accept that product safety and effectiveness must be considered at every stage in the product realization process, such as when identifying user requirements and uses, during device design, when selecting materials, when doing process development, during supplier selection and qualification, during manufacturing, labeling, user training, installation, service, and post-market product handling. In other words, it should be a womb-to-tomb practice. The objective of every medical device manufacturer is to produce safe and effective devices at a profit. Some believe that investing in an effective quality system is a waste of money, or they are too small to have an effective quality system, or they don't have the capital to operate in a state of control. From a very short-sighted perspective, it may be true, a full-blown quality system may be out of reach. Yet, nothing could be further from the truth, when viewed from the big-picture perspective. Regardless of the size of the firm, if the system is properly designed and fitted to your specific operations, it is not only affordable but will offer huge benefits. Let's review the benefits. The benefits from maintaining a state of control: increased product safety, increased effectiveness and customer satisfaction, reduced product liability exposure, reduced regulatory risk, less scrap and waste, much less confusion and fewer mistakes, lower cost, higher employee morale, and higher profits. In this presentation we address the most frequent question from our clients concerning operating in a state of control. Send us an email to receive a printout of this presentation. As always, any one of us at FDA Compliance Help would be happy to answer any other questions you may have, at no charge. We would also be delighted to discuss your specific situation and provide you with a proposal to help you operate in a state of control, as defined by the United States FDA. Thank you for listening.